Hello. Just waiting for some people to hop on. I know I kind of say that every time, but just waiting to kind of get around 100 and then we'll go ahead and get started. Okay, we'll go ahead and get started. I just kind of want to update. We update our numbers every day at 4 o'clock, but we do have 2 new cases reported yesterday evening that we've been investigating today. So that'll take us to 24 cases, and you'll see that reflected in the 4 p.m. update with the case counts. So wanted to let you know about that. The other thing is I want to talk a little bit about testing before I start looking through the comments and discussing those questions that will be rolling in. A couple of things on testing. So over the last week, the county, not we as the health center, in the county, about 100 people have been tested. That's what we've gotten in as reported as negatives or pending, that type of thing. Now, again, I just want to reference that they are not required, healthcare providers are not required to send us pendings or negatives. They don't have to by law. The only thing that they have to send the local public health department are positives. So it's very possible that more people have been tested than what we know of. But as far as what we know, about 100 people have been tested over the last week. So that's 321 people as of this moment that we know of that have been tested for COVID-19 that are St. Francis County residents. That's less than 1% of our population. If you look at the testing capacity of the state, they're also testing a little less than 1% of the state population at this time. Now, I say that to kind of say this. We don't test here at the health department. Our role is to investigate disease. And so that's what we do is investigate, positives, investigate contacts to positives, do that type of tracing that you've heard a lot about, maybe at the national level about contact tracing. And so that's really one of our primary roles here is to do disease investigation. Now, testing is a concern throughout the entire state. And I've heard from other health department directors, and that is a concern across our state and other places in the country. And I think it's getting better in general, but it's still an issue. Even St. Louis County, where you see most of the cases, if you go to their website, they talk about testing capacity, and it is a concern, and it's something that is a gap in the system, and it just doesn't look the way that we think of rapid testing in the way of flu, where you go to your doctor, you get tested, you have a result right then. It's not there yet. It might be at some point, but right now it's not there yet. I know that there's been lots of reports of having issues with getting tested. The healthcare provider is who does that assessment and assesses whether or not somebody's going to be tested. The doctors, the hospitals, clinics, that type of thing. We have to put faith into them to use their clinical judgment to test people. And certainly when people are tested, we're able to know if someone's positive or not, and we're able to do our part in isolating and quarantining, the appropriate contacts. Remember, isolation is for people who are confirmed as being ill. Quarantine is for people who have been contacts to someone who is ill but is not yet sick themselves. So that's really the important part to know about testing. If you are sick, you need to reach out to your healthcare provider to discuss with them if you are going to need to be tested or if there's a possibility that you need to be tested. Okay, I did have a question about private testing. So if you could just opt to pay for the test. Again, that's something that the healthcare provider orders, the doctor, nurse practitioner orders that test. And so you need to talk with them about what the situation is for paying for that test. Most of our providers are sending out to private labs. So that means that that test is being billed through insurance, maybe is being paid for out of pocket. Those are things that we're really not in that realm. We haven't had a lot of tests sent out recently to the state public lab, which is what we would consider public testing. because of those private labs coming on board, and we're able to get test results a little faster sometimes, depending on what lab they're going through. I'm going to talk a little bit about the recovery plan or planning here in a minute. I got a question about our residents being tested in nursing homes. So as far as locally, now we know there's situations going on to the north of us in Jefferson County with a nursing home, but locally we have had people tested here and there in nursing homes. Again, this is done through the provider of the nursing home ordering that test. All of those to date have been negative, so that's good. That's not to say that we couldn't have a situation that you see in other places. It's just where we are here in this moment. But we haven't seen anywhere they're testing an entire facility like what we're seeing to the north of us. That's not to say, again, that couldn't happen if a case was identified, and I don't know what led exactly to that entire facility being tested, but I'm guessing that it had to do with a case being identified. So we haven't had that situation at this time, thankfully. Excuse me. Stay-at-home orders. I had another question about if when the Missouri order expires, will the county's order be extended, or basically the difference between the timelines for that. This is my assumption of what I think will probably happen. The county order and the state order, we've talked about those in the past. You can kind of look at those videos from the past, but they're very similar. I do not foresee the county's order going any longer than what the state order goes. I'm pretty positive of that. Again, that's something that we need to continually assess. And, up until today, we had been 9 days without a reported confirmed case. But, we got our 2 in today, and that's something that we're going to have to continually reassess every day. But I do not foresee that order being extended past or continuing past the state order. I'm going to talk a little bit about the recovery planning, and then I'll get to some of these comments that are coming through. So the national guidelines for recovery have been released. You can view those on whitehouse.gov. I would suggest going and taking a look at those. Those are kind of just national guidelines at this point, and the state is working on their own recovery plan. We have not seen that plan. It's in the planning stages, so that has not been released yet. We've looked at those national guidelines. I think those are good guidelines. Some of those rely a little bit on testing capacity, which we know is an issue. But it talks a lot about, excuse me, the trajectory of disease. So whether that's, people that are presenting to the hospitals with COVID-like symptoms or confirmed cases, it's got a really nice layout there on, I'm sorry, I gotta get a drink. whitehouse.gov to help kind of navigate on how to go through phases. So the national level is a phased process to continuing back to normal life, which we've talked about in the past, that most likely we knew that when stay-at-home orders are ceasing or expiring, that it won't be that we just go back to normal life as it was before, that it's some type of phased process. And again, we have not seen the state's plan on that yet, and I think we'll be seeing that soon. But that's just something to kind of note. And again, the national guidelines are out there that you can take a look at to get an idea of maybe where we're headed to head back to regular life. So. I'm going to try to come back here through some of the comments. Hello. When is this going to end? I don't think that we can say that for sure yet. But in general, cases are going down. So, that's a good thing. And in addition to not just us, but other parts of the state, they're seeing those cases being reported going down. So that's a good thing, and that we're probably headed in the right direction for now. But, our healthcare partners, we've had discussions with them, and the general consensus is that we've got to be careful as to pulling back the stay-at-home orders and be strategic, and that's why those phased process or those phases to move back to recovery or a more familiar way of life, that's why those are important. Because when we take the gas off of, or when we take our foot off the pedal, we're probably going to see an uptick in disease, but again, we don't want to see a surge. So that's important to know, that we're going to have to continually reassess where we're at in disease transmission. And I would say, just to kind of add to talking about cases and numbers, we're able to pull regional data for ER visits. And that data is showing that less people are presenting with COVID-like symptoms, back to what is a normal level for this time. So that's good news too. That also points in the right direction, but we have to be really careful in becoming very comfortable with what was 22 yesterday or 24. We have to be careful in being very, very comfortable with that and thinking, oh, we can, go back to, large gatherings and social distancing. We don't need to worry about that anymore. We still need to follow that statewide order, and maintain social distancing at all times, and really be utilizing that statewide order and CDC guidelines still. Okay. Sorry, I'm gonna go and try to scroll through here. How about multiple inconclusive results? We haven't gotten any results that are inconclusive. So again, I just want to point out that we are only mandated to get positive results, but we haven't gotten any inconclusive results. That may mean that you need to be retested. That's something you need to talk with your doctor on, but we haven't gotten any of those in at this point that I know of. Will the stay-at-home order go through May? It doesn't sound like it. The state's order ends on May the 3rd. I think that, they're going to be reassessing that every day, and obviously we saw an extension, but, it doesn't sound like it. It sounds like at the national level, they're wanting to head towards the phased levels of recovery. When will the county lift the stay-at-home order? I really think that if not before, it will be in line with the state. Although again, those two orders are very similar, and the state is still going to be in place regardless of the county order. So that's important to know. Are we going to have local testing sites? So the testing sites are in the doctor's offices. So doctor's offices, the hospital, the Parkland Urgent Care, the respiratory clinic, those places do the testing. Most of our doctor's offices in the county are testing for COVID-19. So you can call your doctor, you can call the respiratory clinic there at Parkland and discuss with them before you come in about being tested. But there are multiple sites throughout the county that are testing. Trying to... There's a question about why is it fine for Farmington Commissioner to reserve PPE when hospitals are out? I don't know anything about that exact situation. My understanding is that the hospital is doing okay on PPE, but maybe I don't have all the information, but I don't know anything about that situation. Trying to comb through here. The zip codes will be released at 4 with our normal update. I think I know what zip code, but I don't want to say the wrong thing. So we will update that at 4 o'clock or around 4 o'clock on the website and also on the Facebook. But again, I really want to caution on zip code level data. I understand the reason why people want to know, but we need to be careful in getting comfortable with, well, it's in that zip code and not in my zip code. We all need to follow the guidelines. So some of the questions I'm kind of scrolling through because they're kind of questions I've already answered earlier. Is there such a thing as a false negative? There is in general, but the test that they're using right now is called a PCR, and really what that means is it's a confirmatory test. It's very reliable, so that's the good news. Now, we've talked about antibody tests in the past. The thought is that that's going to be in use sometime in the future. Antibody tests are things that we use for other diseases, but there's just really not enough information right now to rely on an antibody test at this moment. We've talked a lot about, so many changes have happened over the last few weeks, and I think the trouble with pandemics in general is that it is so rapidly evolving that you really can ask questions sooner than you get quality research and quality data to answer those questions. And I know that, you all share that frustration. I share that frustration, but even, the most brilliant people who are working on this are also, frustrated, and they don't have all the answers. And so that's important to know that things are changing every day. Every day we're getting new guidance from the CDC, and they're updating their website every day as well. So just keep that in mind. But, false negatives are always a possibility, but by and large, this test is very accurate. So. I'm going to take a couple more questions, and then I'll have to hop off here. We're updating the frequently asked questions on our website. We also kind of fixed the format so it's easier to look at and view, and so you can see those on our website, and we'll update those with some of the questions that maybe we're not able to get to. I see a question about, can I go fishing? Under the statewide order, that's included under there. You just need to social distance. If you're doing activities outside, you need to social distance from other people. I see a question, do they test at Parkland? Yes. If you think if you're sick and you need to be tested, you need to call ahead to talk with them about that. I'm trying to scroll through here. How many cases have resulted from the Bonterre wedding? We've talked about that a few times, but only one case out of the 24 now have been associated with the Bonterre wedding. We're outside of that incubation period. That was back in March. So at this point, we're not going to see any cases that would be directly linked to the Bonterre wedding because we're really pretty far outside of that incubation period. So trying to scroll through here and hit some questions that maybe I haven't answered, because I know some people are just kind of tuning in just now. When will parks be open? I don't have a solid answer on that yet. It really depends. I know that I think Farmington did some extra regulations in addition to what the state said, but it's just really going to depend. The statewide order is still in place, and again, even if the local order is rolled back or we end it, it says until further notice. The statewide order would still be in place, but it's got a whole section in there for like outdoor recreation and what is acceptable under that. But I know some of the parks have closed in addition to state parks because there was a lot of complaints about the crowding in those areas. So that's important to know. Okay, I'm going to take one last question. Will this affect the 2020-2021 school year? I hope not. I've heard different things from different parts of the country, but I hope not. I think if we can continue on a good path, then no. But again, I think it's really hard to look a few months ahead in the future to figure out what that's going to exactly look like, because it depends on what happens now and how people react now to slow the spread of disease. And so the update will be posted at 4:00 on our Facebook and our website. So, stay tuned for that, and we'll make sure that we get those numbers updated. But again, yes, we are at 24. We had two new cases reported yesterday evening. Appreciate you being on. Just want to encourage you to continue to follow the statewide order and the guidance that's been given by the CDC. We appreciate you. We know that this is a difficult time for all of us, and we're all anxious to get back to what life was before, myself included. But we have to be really careful about how we do that. Again, I would encourage you to go read on whitehouse.gov, the phased plan that they have proposed. And again, we're still waiting to hear what the state's plan looks like. And so more to come on that. I will be back on Thursday at 2 p.m. and we'll go back through some of these that maybe we couldn't get to and update our frequently asked questions that are on our website. There's also lots of information on cdc.gov, and I would encourage you to utilize that as an evidence-based resource. So thank you so much. Bye.